For most people, they've done surveys, what is the most important sense to you? What sense would you least like to lose? And overwhelmingly, it's almost always vision. And to have someone put that trust in you, hey, I trust you to take care of this important sight, this important sense for me, is just really rewarding.
Well, while it's true that we prescribe glasses and contacts, optometrists are really part of the overall primary healthcare system in the state of Indiana. And on a daily basis, we can diagnose and help other providers with the treatment of over 270 systemic diseases that were identified by the American Optometric Association.
So when an optometrist steps forward to try to specialize in a procedure, they're very well educated. Each of us have our different specialties or interests. I think it's very important that we continue to learn and we have access to advancing procedures, because the demand for medical eye care is only going to increase, especially by 2035, by about 24%.
I think basically just to understand how much we can actually see when we examine the eye. We can see signs of potentially systemic issues going on.
In our area, the closest referral center is going to be almost an hour drive. In being able to have patient resources and the scope of our practice to be able to keep those patients, hey, you need a laser touch-up on your implant after cataract surgery. Hey, we can do this here in our office. It's going to take us 90 seconds. So that makes a huge difference for those patients who are deferring those critical procedures, important for their own independence.
There's been so much technology that's come across since I've graduated, and the technology that we had's gotten even better. With our new machines that we have out these days, I can take simple scans, and with those scans, I can now get a very tailored contact lens to help my patients with these corneal diseases see so much better than I could before.
And it's important for people to have their yearly eye exam, because we can act as their liaison between their primary care doctor, the rheumatologist, endocrinologist, neurology, to make sure that they are getting the care that they need.
In my practice, I do see a lot of children. I have these kids that are coming in and they're struggling with grades, they're struggling with attention.
I think without optometrists going in and doing vision screenings, a lot of times kids can get missed, especially with problems like farsightedness, because they can often pass a routine, they can read the chart on the wall, but they may have trouble reading their screens or reading their assignments. Also, kids that have problems with just one eye, that may get missed. They're very good at hiding that. When they can see out of one eye, they know how to make that work for them, and so sometimes they don't know that they're even doing that. And we have caught so many kids who didn't know that they had a problem, had never been to the eye doctor before. I think early access to care is so important, and we always recommend that babies get eye exams between 6 months and a year. There's a lot that we can check for just to make sure that everything's developing properly, and then we can prevent problems like lazy eye from happening down the road, that if we waited till they're older, it might be a little too late to prevent some of those issues.
So we're so fortunate in Indiana, we have a great scope, and that's something we're going to fight to continue every day. With optometry, it's so hard to see where that's going, with the evolution of AI.
And patients are coming in much more educated already on the basis of their diagnosis.
Optometrists are the first-line providers for eye care across the state, really across the country. And I think eye care optometrists can be the quarterback for patients and their eye care needs.
The soul of an optometrist is really about helping people, and that comes in all different walks other than just giving eyeglasses.
I think just having easy access to care is so important, because people don't do things when there's a lot of barriers in the way.
Giving the patients that knowledge that they didn't know to ask about is very important. And just like the legislators may not know that we do those things, patients don't necessarily know that we do those things.
On an everyday basis, Hoosiers benefit because across Indiana, optometrists are involved in the healthcare system. We can improve overall health outcomes for patients by allowing them to see better for a longer period of time. That improves Hoosiers' quality of life and overall reduces stress on the healthcare system. And it's through our education, training, and technology that we're able to better the lives of Hoosiers on a daily basis.